I'm seeing a surge of videos against Ayurveda. Have you noticed too? A video that I watched recently, a few doctors are blurting out against the usage of LEHYAM in postnatal care for women. They in fact suggested that that is the reason for weight gain. Now the reasons for weight gain postnatally is like there are a lot of studies for that. The reasons like lack of breastfeeding, lack of exercise, sedentary life, lifestyle, race, etc. are some of the main reasons actually for postnatal weight retention. Now, instead of all this, instead of mentioning everything, they prefer to talk about or talk against the usage of LEHYAM. Now, LEHYAM is actually form of a drug. It's not even a drug per se to talk about it in specific. If I were to say that syrups cause obesity, I would sound like a pharmacological stupid or an illiterate from that perspective. I do not know why these doctors preferred talking like that. Seriously, I'm still frustrated. And postnatally, we use drugs like Shadavari, Tamarindus indicus, we call Puli. These are known agents for potentiating insulin, which means it sensitizes your insulin secret in your body, endogenous insulin, and many other spices. So none of it are going to have an effect in your weight gain. Seriously, we don't have any medical evidence for their statements. And if it was just based because of their ignorance, they didn't know much about Ayurveda, it could have been more forgiving for me because their agenda was not that. They want to place their brand, they want to brand. They have a new hospital, a birthing center, Giggles, Kinder, Pebbles and all. So immediately once you have to brand, then you have to spew on Ayurveda to place yourself, to create that hype. Now that is the agenda that is more disturbing because people should be wary of such institutions also. Because if they can actually hurt an age-old science with nonsense, with no evidence whatsoever, they can do the same thing to you as a person. We wouldn't know what exactly will happen if you go to such centers because they do not have this ethics or morality before spewing something like this, some rubbish like this. I really request medical institutions to refrain from such branding, from such promotions. And I also request government regulatory authorities to look into this kind of exploitations, to look into this kind of promotions. I request all the medical authorities to look into this matter strictly because this is totally unfair. They do not have any evidence whatsoever when they talk like this in a public forum. I think a lot of misinformation there. Thanks for listening.